who is breastfeeding your child, or maybe you're expressing breast milk for your child and you need to have a surgery or have a radiology procedure done on yourself. And I have a feeling that you've been told in your pre-op conversations or your pre-procedural conversations with your doctor that you might need to pump and throw your breast milk away after you've had your surgery or after you've had your MRI or your CAT scan. So let's talk about where the real truth is in that message. So there are many guidelines and statements, and we have links for you to be able to click through to follow for yourself that show that the minute that a mother has recovered from her surgical procedure and is safe to hold her baby, you're safe to breastfeed your baby. So if you are recovering from anesthesia of a procedure and you are so out of it and loopy from the medicine that you can't hold your baby safely, then you should not breastfeed your baby. And you should pump and empty your breasts during that time if it will be more than 4 hours. But most people, when they leave the hospital or a same-day surgery center, most of the time they are able to hold their baby safely within a few hours after the procedure. So there's nothing magical about pumping and throwing your milk away for 24 hours. Anyone who quotes a 24-hour time frame has completely made that up. There's no evidence to support 24 hours for every known anesthetic agent that is given. So please double check when you're given that advice and use these guidelines from surgery and anesthesiology bodies to help guide that. If you are getting a CAT scan or an MRI, there's a myriad number of radiology studies that you might be getting. There are a rare few that involve radioactive material. And okay, fine, I understand we cannot give your radioactive milk to your baby. But other than that, most of the radiology procedures, it is safe to give the milk to the baby. The contrast agents that are used in the vein do not go through the intestines into the milk, into the baby. Because if they did, then we wouldn't need to give them through the IV. We would give them to the patient through their stomachs as well. So read the details in these statements. Have a good conversation with your surgeon, your anesthesiologist. How about a colonoscopy, for example, where you might get propofol? There's another time where the minute that you're safe to hold your baby, you're safe to feed. So please take a second look at those recommendations if you ever hear just sort of a knee-jerk pump and throw your milk away. Always be ready to double check that, because the education of the healthcare system is behind in the knowledge and evidence that's out there.